Welcome to The Explainer. Today, we're diving into a health crisis facing India's tribal communities. And let me tell you, it's not at all what you'd expect. The data reveals this incredible story of deep paradoxes, a complex reality that really challenges everything we think we know about health and progress. Okay, let's start with a number just to get a sense of the scale here. 104 million. That's how many tribal people there are in India. I mean, think about that for a second. That's more than the entire population of the United Kingdom. It makes up over 8.6% of India's total population. It's huge. But here's where things get strange, where the first paradox just hits you like a ton of bricks. Between 2001 and 2011, India's general population grew by a massive 17.7%. The tribal population, though, it grew by just 0.4%. I mean, that's practically standing still. In fact, many specific communities are actually shrinking. So yeah, that staggering difference forces us to ask a really critical question, and it's one that's going to frame our entire explainer today. What on earth is happening to India's tribes? What is causing this silent decline? Well, a huge part of the answer lies in this deeply counterintuitive health crisis, something researchers have started calling the triple burden of disease. It's a concept that seems to completely defy logic, but it's the reality on the ground, and it's a key reason for that population crisis we just saw. So what exactly is this triple burden? Well, it's this wild situation where a community is dealing with the problems of not having enough food, undernutrition, and at the same time, the problems of modern access, like rising obesity and diseases like hypertension. Think about that. Scarcity and surplus hitting the same people all at once. All right, let's break it down. Burden number one is the one you might expect, undernutrition. And this isn't a new problem. It's a chronic, persistent crisis. We're talking about 40 to 50% of tribal community members suffering from it. That's a severe, decades-long issue. But then, layered right on top of that, we get the second burden, obesity. Now, this is the newer rising threat. And it kind of goes against everything you'd think, right? Recent studies show overweight rates are now exceeding 11% in these same populations. It's a massive metabolic shock to communities who have never ever had to deal with this before. And this brings us to the third piece of this crazy puzzle, hypertension. We're talking about a silent epidemic here. Some studies are reporting that prevalence is as high as 25%, a quarter of the people in certain communities. So get this, you have underfed people who are simultaneously developing high blood pressure. It's a perfect storm of health challenges. So the big question is, how can these opposite problems even exist in the same place? Well, the answer lies in another paradox, the unintended and frankly often devastating consequences of what we call progress and modernization. You can see it happen in this tragic four-step process. First, urbanization and development projects lead to displacement. Then, that displacement severs their connection to their traditional diverse foods from the land. Third, they become dependent on government food rations, which are often way less varied and nutritious. And the final step? Well, this new diet, combined with a less active lifestyle, triggers that whole wave of diseases we were just talking about. And this quote from one of the reports, man, it just says it all. Being poor and indigenous increases the risk of premature death by 3 times than the other community in the society. This isn't just a health issue. It is a profound injustice with literal life or death consequences. Now, if we zoom in even further, you'll see that this crisis doesn't hit everyone equally. Within this already vulnerable population, the burden falls hardest on one group, women. And this is where we uncover yet another paradox, this time all about gender. Okay, so check this out, because it's a real head-scratcher. In many of these tribal societies, there's traditionally more gender equity than in mainstream Indian society. And yet, tribal women face a risk of being undernourished that is 2 to 3 times higher than women in the general population. For elderly women, that risk is 3 times higher. It just doesn't add up. And this vulnerability is something that shadows them their entire lives. When they're under 40, they're dealing with malnourishment and the dangers of early motherhood, which kicks off this vicious cycle that gets passed right on to their kids. Then, over 40, they not only face severe undernutrition, but also the very same lifestyle diseases like hypertension. They are literally trapped between 2 health extremes. So with all this data, you'd think we'd have a clear path forward, right? A clear set of solutions? Well, that brings us to our final paradox of the day, the knowledge paradox. The problem is that while we can see this crisis unfolding with shocking clarity, we are really, really struggling to find the right, culturally sensitive solution. This just shows you how much we still don't know. The health of the elderly, it's a total black box, almost completely unexplored. We don't really get the cultural drivers behind people's health choices. And maybe the most alarming part? Those depopulation numbers we started with, the root causes are still, fundamentally, a mystery. We are essentially flying blind in these absolutely critical areas. And that leaves us with the ultimate question, doesn't it? As communities all over the world continue to change and modernize, how do we make sure that development actually leads to well-being and not just disruption and disease? What does real healthy progress actually look like for some of the world's most vulnerable communities? That's the question we really need to answer.